Extra, extra, we're back with another topic. Before we begin, I want to state that my job over here at Jaundice Journal is not to offend the homosexual community, but rather to expose the racism that plays a part in the homosexual community. That's my only job. That's my only goal. So without further ado, let's get into it. As we've seen thus far, racism leaves no stone unturned when it comes to the North American Negro male. Is medicine for HIV prevention easier to access for the North American white male than it is for the black and brown homosexual male? Interesting. But before we get into that, let's see how this virus affects Negro males. Article: HIV rates in young black gay men strikingly higher despite fewer risk behaviors. Northwestern University investigators exploring the racial disparity of HIV acquisition found that young black men who have sex with men are 16 times more likely to be infected with HIV than young white gay men. Perhaps what's more noteworthy is that young black gay men reported lower rates of sexual risk behavior, fewer sexual partners, and more lifetime HIV tests, according to the results of a study published in the Journal of Acquired Immune Deficiency Syndromes. We have known from prior studies that this paradox exists. Black young men who have sex with men engage in fewer risk behaviors but have a much higher rate of HIV diagnosis. Senior study author Brian Mustansky, PhD and professor of medical social sciences at Northwestern University Feinberg School of Medicine and director of the Northwestern Institute for Sexual and Gender Minority Health and Well-Being, said in a statement, "Our study illuminates how HIV disparities emerge from complex social and sexual networks and inequalities in access to medical care for those who are HIV positive." The longitudinal cohort study included data from 1,015 gay men between the ages of 16 and 29 who lived in Chicago, and also factored in psychosocial characteristics as well as information about social, sexual, and drug use behaviors. According to the data, young black gay men had a higher prevalence of HIV and rectal sexually transmitted infections, but the lowest number of sexual partners, more frequent HIV tests, and experienced greater levels of stigma, victimization, and trauma, childhood sexual abuse. Overall, young black MSM do not report higher rates of HIV risk behaviors like condomless sex, study co-author Ethan Morgan, PhD, said in a statement, but aspects of their social networks align with increased HIV risk. By learning more about young black MSM's social networks, we can better understand what drives such persistent racial disparities in HIV and close the gap. U.S. Centers for Disease Control and Prevention reported that gay and bisexual men accounted for 67% of all HIV diagnoses in 2016. Of those, African Americans comprised 38%, followed by Hispanic Latino men 29% and whites 28%. The population of HIV-positive black gay men also tends to be younger. 75% were between the ages of 13 and 34 in 2016. Dr. Mustansky and his team believe their results suggest that network interventions and those addressing social determinants may help reduce the disparity, their study showed. Their social and sexual networks are more dense and interconnected, which from an infectious disease standpoint makes infections transmitted more efficiently through the group, Dr. Mustansky said in the statement. That, coupled with a higher HIV prevalence in the population, means any sexual act has a higher chance of HIV transmission. Did my reading put you in a docile state? I hope not. If it did, let's just recap the article that we just read. African American young gay males are 16 times more likely to contract HIV than young white gay males. But the Journal of AIDS published a study that young black gay males reported lower rates of sexual risk behavior, fewer sexual partners, and more lifetime HIV tests. Brian Mustansky, a man of many titles, says he knew this from prior studies, but has a study of his own based on social network and inequality in access to medical care. Young black gay men, according to data, have higher prevalence of HIV and rectal sexually transmitted infections, but lower numbers of sexual partners. More tests, but went through greater types of abuse, trauma, victimizations, and stigma. CDC reported that in 2016, gay and bisexual men accounted for 67% of all HIV diagnoses. African Americans led with 38%. Hispanics were next with 29%, and white males with 28%. Let's not forget the population of HIV positive black gay men is also younger by 75%. So this is disproportionate all the way around. This article is an eyebrow raiser. I hope you're being educated on HIV and how it affects the African American community, especially the Negro male in North America. This is all important and an eyebrow raiser. We see the impact of HIV on the gay North American Negro male. Now let's look at medication. Racism and inequality doesn't rest its eyelids in North America. It doesn't miss a beat. And we'll do the same thing over here at Jaundice Journal when it comes to covering these things. A 2017 article from Vice goes on to say, PrEP access for men of color is a thornier problem than we think. Too few are on the drug, and encouraging adoption is going to involve more than awareness campaigns. So when I read this lengthy article, which we're not going to read in its entirety right now, my heart just went out to the young Hispanic gay males and the young black gay males, because they have a plight too. We always have to keep that in mind, right along with not being in a docile state when we read articles or look at movies or look at TV shows. We always have to have compassion on people that's the same race that we are. So we're going to get into this article. The most troublesome aspect of PrEP's rollout lies in its lack of uptake among MSM, who are people of color. Last February, the CDC estimated that if current infection rates continue, half of African American and 25% of Latino MSM will end up infected in their lifetime. Those figures are nothing short of staggering. The larger problem is one of treatment access and quality for HIV positive Americans in general. Only half of positive Americans are currently receiving adequate HIV treatment. But among HIV negative Americans, Black and Latino MSM are among those using PrEP the least. The 2015 UCLA APLA survey found that while 13.9% of white young MSM respondents were on PrEP, only 6.6% and 9.8% of Latino and Black MSM were respectively. And an estimate by Gilead Sciences, Truvada's manufacturer, found that only 9% for PrEP prescriptions written have been for African Americans. It's been called a tough sell among the gay Latino community, and critics have cited everything from healthcare access to the drugs cost, estimated to be upward of $1,500 monthly, without insurance, to larger systemic barriers in explaining away its low usage among Black and Latino MSM. Young Black homosexual males and young Hispanic homosexual males can't get their hands on medication needed to help them fight for their lives. We have to blame this on the racist institutions of North America. They leave no stone unturned. They know that these people are the most affected, no matter how much they have low risk sexual activity, no matter how many sexual partners they have. It's unfair. It just brings me back to the nationwide protests going on currently. It's like law enforcement was so absent-minded that they killed an unarmed black man for no reason, that sparked a national outrage and made people protest in the middle of a pandemic, even though blacks and browns are disproportionately affected. My heart goes out to the Black and brown people of North America. My heart goes out to the Black and brown homosexual men of North America as well. They don't need any more hate, because North America institution and its system does it already. To hit the comment section and leave me a comment, because it's time for us to part ways. What do you think about the institution of North America and how it treats the black and brown young homosexual men of the LGBTQ community and the homosexual community? Do you think it's war on their lives by not letting them get their hands on the proper medication that it takes to help them fight for their lives? Let me know. If you want others to see this video, share, but don't forget to like and subscribe. Peace.